San Antonio Health Insurance, Patient Protection, Affordable Care Act, by Sean L. Johnson, www.sanantoniotxinsurance.org. When looking into San Antonio Health Insurance, and trying to learn more about the subject, Azine articles can be a great source. Lots of excellent information there, from lots of great authors, each with a slightly different perspective. I found the article below, and really like the information it covers on San Antonio Health Insurance. Health Insurance, Patient Protection and Affordable Care Act, by Sean L. Johnson. The PPACA, which is short for the Patient Protection and Affordable Care Act, was signed into law on March 23, 2010. President Obama approved this bill to improve health care, along with the Healthcare and Education Reconciliation Act of 2010. There are many health-related provisions that will take effect for the following 4 years, and Texas health insurance will be affected, just like insurance in all the other states. New provisions include prohibiting denial of coverage due to pre-existing conditions, increasing Medicaid eligibility, creating incentives for businesses to offer health care benefits, creating health insurance exchanges, provide support for medical research, and subsidizing insurance premiums. The costs for all these new programs and changes will be paid for by fees and taxes. Additional measures to pay for these new programs include taxes on indoor tanning, new Medicare taxes for those in a high-income tax bracket, fees on medical devices, a tax for people that do not get health insurance coverage, and Medicare Advantage program fairness changes. The Congressional Budget Office is estimating a federal deficit reduction of $143 billion over the first 10 years. There are some provisions to this act that started immediately, others started at the end of September 2010, and still others will not go into effect until 2014. Some more key provisions of this bill include an increase in the Medicaid drug rebate, the creation of the Patient-Centered Outcomes Research Institute, and the creation of the National Prevention, Health Promotion and Public Health Council. Dependent children will now be covered under the parents' Texas health insurance plans, as well as all other states, until they are 26 years old. Insurance companies are now prohibited from dropping insured when they become sick. The following provisions will be rolled out over the next few years. Employers must notify employees of the value of provided benefits on W-2 forms. Customers will receive a rebate when insurers do not spend at least 80% of small group and individual or 85% of large group premiums. Flexible spending accounts, health savings accounts, and other such accounts will not be able to be used to pay for over-the-counter medications. When self-employed people earn more than $200,000 annually, they will be subject to an additional 0.5% tax. Insurers will be prohibited from charging higher rates or discriminating against people with pre-existing health conditions. Annual spending caps will be prohibited. Chain restaurants with more than 20 locations will be required to show the caloric content of foods on drive-through menus, vending machines, and dining-in menus. If you need assistance in locating particular coverages at a predetermined price, we can help save 50% on health insurance. Sean L. Johnson is a journalist for Health Insurance Buyer, a referral service that refers consumers to the insurance carriers that can best fit their wants and needs. Get a free reduced quote today at www.healthinsurancebuyer.com. Article source, azinearticles.com/expert = Sean L. Johnson. Okay, what was your opinion on the article? Did it meet your expectations? Whenever you're reviewing information on San Antonio Health Insurance, it's always nice to have several sources to draw from. Azine Articles is a favorite of mine, and that's why I often go there when doing my own research. Article source, azinearticles.com/expert = Sean L. Johnson. Music by Kevin MacLeod.